We've been talking about Obamacare for, what, 2-3 years now, and we're still not there yet. They've punted on the employee mandate. That's moved. The big thing of all this is that the IRS is going to administrate this plan, and some like Max Baucus have actually called this a train wreck. So let's find out about it. Let's talk to Congressman Tom Price of Georgia. He joins us to discuss this new bill, Keep the IRS Off Your Health Care Act. What are we talking about?
Hey, Dave, don't you think it's a good idea?
I think it's a great idea. Walk me through it.
Thanks so much. Good to be on with you. I was sitting there in one of the hearings in the Ways and Means Committee when the IRS was before us and revealing this incredible violation of the public trust in targeting tax-exempt groups and then leaking their donors and then targeting their donors for audits. And it hit me that the IRS is the enforcement arm for Obamacare, for the Affordable Care Act, and so that doesn't. I knew that didn't make any sense when they instituted it, but at this point, the IRS, the Internal Revenue Service, has violated any trust it ever had with the American people. So I introduced a bill, H.R. 2009, that says the IRS may not participate in any enforcement or implementation of the Affordable Care Act of Obamacare. We're going to vote on that on the floor of the House this week. I'm excited by the almost 140 co-sponsors that we've got, and I'm calling on the Democrats who have voiced their concerns about this proposal or this portion of the law as well to join us and vote for H.R. 2009.
Hey, Tom, I want you to listen to this very short clip. It's Max Baucus talking about the train wreck. Let's go to that clip right now.
Small businesses have no idea what to do, what to expect. They don't know what affordability rules are. They don't know when penalties may apply. They just don't know. People are going to be really confused. I tell you, I just see a huge train wreck coming down. And you and I have discussed this many times, and I don't see any results yet. I just see a huge train wreck.
Tom, is he right?
Well, absolutely, it's right. And the important aspect of that quote is that this is Max Baucus, who was one of the primary architects.
I know, it's frightening, isn't it?
Yeah, as a Democrat senator, and he recognizes that this isn't ready for prime time, and the administration has. They kind of they provide these little waivers, and then they do big ones with blog posts, the employer mandate delay that you noted. But we believe that it's appropriate to delay it for employers. Yes, it's also appropriate to delay it for the American people, and we're calling on the administration to delay all aspects of Obamacare, all aspects of the Affordable Care Act for at least a year. There's no reason that we ought to put Washington in charge of our health care. That's something as personal and intimate as the kinds of decisions that you and every other American make for your health care. The federal government ought not be involved in knowing and dictating to you exactly what you must do.
Well, I've said it in the past. My confidence is very low given the antics that we've seen come out of the IRS. But there's been two breaking things that have happened recently, two stories that I've read. I'd like to get your viewpoint on it. One, we all know about the tragic affair going on in Detroit, the bankruptcy that's been taking place there. And now there is some talk of, I believe, city workers, and correct me if I'm wrong on any of this, because I could very well be, that city workers, their pension plans, which afford health care far better than anything Obamacare could do, that they may be forced into Obamacare. They're fighting that. Sure. That's number one. The number two, the thing I found really interesting is there's an article out there, and it's starting to hit the press, that federal employees, especially people that work for congressmen and senators, are very upset because they may end up on Obamacare. And they're trying to figure out some end around for these people. Is that right?
Well, both of those points are fascinating. The first one about the pension for union workers. James, no less a figure than James Hoffa, the president of the Teamsters Union, sent a letter to Harry Reid and Nancy Pelosi saying
these are the same people that backed President Obama in the first place. Am I correct?
Exactly.
Okay.
So and strongly and backed this law. And this letter said explicitly, and then they released it publicly, said explicitly, look, this isn't what you told us it was going to be, this being Obamacare. This isn't what you sold it. You sold us a bill of goods. We want it changed. We supported you. We put you in office. Now change it. Basically, that's what the letter said. So all sorts of folks on the other side who were supportive of this law are recognizing that it's a train wreck, as Max Baucus says. The second issue, the federal employees, when we were debating this in 2009 and 2010, Republicans, I was one of them, said, look, if we're going to force the American people into these exchanges, then the least we can do is have members of Congress have to participate in the exchange. And the Democrats fought it, and they fought it, and they fought it, and then at the very end, in the Senate, they actually accepted that amendment. It was from Chuck Grassley, Republican senator from Iowa, and they expanded it to include not just members of Congress but our official staff. So we have to participate come January 1 in the exchanges, which I think is perfectly appropriate, because if the American people are going to be subject to all of this nonsense, then we ought to be as well. I promise you that will be a huge impetus for members of Congress on both sides of the aisle, Republican and Democrat, to change this law so we move toward patient-centered health care, which means patients and families and doctors making medical decisions, not Washington, D.C.
I'm curious to see how that turns out, Tom, but I want you to take off your congressman hat for a second. You are also a physician. Walk me through this law from a physician's eyes. What do doctors think of this bill?
Well, I appreciate that. I spent 20 years taking care of patients before I came to Congress, and I get contacted every single day by former colleagues and other physicians across this country who are so concerned about their inability to currently take care of their patients in the way that they deem fit, most appropriate, and the understanding that they have and appreciation that they have that this law will make it virtually impossible for them to do what they believe they need to do for their patients. Now, why do I say that? Well, there are all sorts of things in the law, including the Independent Payment Advisory Board, which is this panel that will dictate to physicians what they may be paid for prospectively, but also retrospectively. So the federal government will come in and say to Dr. Smith, you did this to Mrs. Jones. We don't believe that was necessary, after the fact, and then take that money back from Dr. Smith. That puts a chilling effect on that physician-patient relationship. And I've had so many physicians, and there was an article in the Wall Street Journal yesterday that on the front page that highlighted the number of physicians who are saying, we're not going to be able to continue to practice medicine if this goes into effect, losing the talent and the treasure of this country that ought to be at the prime of their career taking care of patients, and we're kicking them out the door.
It's fascinating.
Take care.
That, of course, was Congressman Tom